Dr. Azhar Alam, consultant gastrointestinal, advanced laparoscopic and laser surgeon. Today we are going to talk about a very important health issue in males, which is known as hydrocele. Hydrocele is something which we all have heard about, and a lot of men today face this problem. So basically, what is a hydrocele? Hydrocele is nothing but fluid accumulating in the scrotum. That is, in the layers surrounding the testis, when fluid accumulates, it is known as hydrocele. So the next question comes, I have a hydrocele, what could be the cause? Hydrocele normally, when it happens in children, it is known as congenital hydrocele, and they tend to go away on its own. In adults, hydrocele mainly occur because of any form of trauma, any infection, or it could happen also as a result of any tumor. My patients often ask me that I have a hydrocele. Do I need to get anything done? It's just fine. It's just a swelling. It's okay. I don't have any problem. But the problems of a hydrocele, if you leave it ignored, is that it can lead to a number of complications. The number one complication in young males is it can lead to testicular atrophy. That means because of the pressure of the fluid in your scrotum, your testis will actually grow smaller in size. It can result in infertility. Hydrocele can also result in infection. So if the fluid inside the scrotum, if it gets infected, it can lead to pus formation. The hydrocele can rupture. The other thing which we have to note about hydrocele is that sometimes any malignancy, any tumor or a hernia can also mimic itself in the form of a hydrocele. So you may actually be having a testicular tumor or a complete hernia, and all this while you must be thinking that, oh, it's just a simple hydrocele. So to actually find out what it is and what the cause of the hydrocele is, you need to get evaluated by someone who is a specialist in that particular area. So now you know that you have a hydrocele, there is a swelling. What to do next? What are the treatment options? There is no medicine that can cure hydrocele. The one and only option for the treatment of hydrocele is surgery. You can either go via the open method, or today we have an advanced laser technique for the surgical treatment of hydrocele. The advantages of laser treatment, particularly for hydrocele, are that it's a daycare procedure. After 2 hours or 3 hours, you can easily go back home. You can start all your regular activities from the next day, and it causes minimum pain compared to the open surgery, and it is practically bloodless as compared to the open surgery. There are two questions which my patients often ask me regarding hydrocele. Is one, does surgery cause infertility? And the clear answer is no. Ignoring a hydrocele can cause infertility. Surgery for hydrocele cannot cause infertility. The second common question which I get asked is that once I get treated for hydrocele, is this a permanent cure? The answer is yes. Once you get the treatment done for hydrocele, any surgical treatment, that is a permanent cure for that side of the testis. So if you have a right-sided hydrocele and you get a proper surgery done for your right-sided hydrocele, that is a permanent solution. There mostly will never be another hydrocele on the right side. There is another question which people often get confused is, are there any alternative therapies for hydrocele? So there are a lot of misconceptions regarding alternative therapies. So let me make it one thing very clear, that for hydrocele particularly, no alternative therapy is useful in the treatment. You can try out alternative therapy, but trust me, mostly it will not get resolved. You need surgical management if at all it is truly a hydrocele.